Thank you and welcome to my YouTube channel. And if you have subscribed, a big thank you to you. If you haven't, hopefully you'll be considering doing that today and possibly share. I'll be discussing rheumatoid arthritis. Now, who are the people that are more likely to develop rheumatoid arthritis? Number one, females. Now, the ratio of females to males developing rheumatoid arthritis is 2 to 3 to 1. In other words, for every 2 to 3 females, you would have one male developing rheumatoid arthritis. At what age? Usually in their 30s, their 40s, maybe earlier, maybe later. Now, the question then is, why do people develop rheumatoid arthritis? We don't know exactly why, but there mix a number of times of reasons why this could occur. Now, we usually will class these as genetic factors and environmental factors. When we say genetic factors, we are talking about the fact that if you're dealing with a female patient that has developed features of rheumatoid arthritis, you need to look back a little bit. Ask questions about the mother. Ask questions about the grandmother. A number of times you would find a situation where people in the family have also had similar symptoms in the past. And so there is a strong genetic history that is associated with rheumatoid arthritis. Now, when we come to the environmental factors, there are a number of associations, so to speak. Smoking. Now, this is not to say that all persons that smoke will develop rheumatoid arthritis. Neither is it to say that if you don't smoke, you won't develop rheumatoid arthritis. It's simply an association. And as we go on, I'm going to explain why smoking is such an important factor. Others could be infectious factors. In other words, a patient previously had an infection from a viral disease that triggered the onset of autoimmune disease that I've explained previously. Of course, hormonal factors. I've just mentioned that females are more likely to developing rheumatoid arthritis. And so if they're more likely, it's obvious that because of the hormones they have, that seems to be a risk factor for the occurrence of rheumatoid arthritis. What's the real problem? What essentially is the problem in rheumatoid arthritis? Now, I'm going to explain certain aspects that may be a little bit complex, but I'll try to explain as much as I can. Let's say there's an external factor such as smoking or infection. This triggers an autoimmune reaction like I've just explained. Essentially what they do is that they lead on to synovial hypertrophy, I'll explain that in a bit, chronic joint inflammation, along with the potential for extra-articular manifestations. Now I'm going to break that down a little bit. Now, when we say synovial hypertrophy, in the joint, there is a membrane called the synovial membrane. It's a thin layer. However, when patients develop rheumatoid arthritis, that thin layer becomes increasingly thickened. That's what is meant by hypertrophy. So it increases in size, and there is uncontrolled, unregulated chronic inflammation. Now, when this occurs, that synovial membrane that's supposed to be a thin layer becomes so thickened that it's called a pannus. Now, this pannus is aggressive. It will damage every structure on its way. It will damage the bone, it will damage the cartilage, so whatever is around the joint becomes a target for destruction. And so essentially this sets the stage for the deformities that you see in patients that have rheumatoid arthritis. Now let's use cigarette smoke as a prototype of a trigger for rheumatoid arthritis. Remember, I've mentioned that it's not everyone that smokes that develops rheumatoid arthritis. Neither is it that those that do not smoke will not develop rheumatoid arthritis. But it's been studied to the point where we can explain what's going on. Now, cigarette smoke promotes what is referred to as post-translational modification using an enzyme referred to as peptidyl arginine deaminase 4. Now, what that does is that it brings about a process referred to as citrullination. Now, citrullination essentially changes the structure and function of proteins. There is an amino acid referred to as arginine. Now, this enzyme converts the arginine to citrulline. So that process of conversion of arginine to citrulline is referred to as citrullination. Now, when that happens, the protein in the cell is altered, and because it is altered, the other cells of the body read it or assume it to be foreign. Remember, I've explained the basis of autoimmunity. And so because they read it as foreign, they then begin to attack the cells because, after all, they're not supposed to be here. Now, it is this attack or this destruction of these cells that forms the basis of autoimmune disease, autoimmunity, which is self fighting self, or the concept of self-destruction. Thank you very much. Hopefully, you will continue with other videos concerning rheumatoid arthritis series. Thank you.